So, hello guys again, Mr. Riley here. Today we're going to be looking at injuries within sport and the different types of injuries for this little revision video. So as you can see on the screen at the moment, we've got the different types written down. So concussion, fractures, dislocation, sprain, torn cartilage and soft tissue injury. You might remember quite a bit about some of them, not so much about others, so we'll go over them again. First injury to look at is concussion, and this is a traumatic brain injury that affects your brain function. So when you get a bash on the head, it can affect your brain and your brain functions. Usually these effects and the impact it has when you hurt your head is temporary, and these can include things like headaches, problems with concentration, problems with memory, not remembering things, your balance and coordination. But research has shown that if you have frequent concussions, so you keep having concussions regularly, that can result in long-term problems. And there's lots of research going on at the moment about ex-footballers who used to head the ball all the time and suffer from concussions, and rugby players who suffered a lot of concussions and now they're struggling with things like low mood, memory loss, struggling with their balance and having headaches, all these things we can see, but they're still having them now 20 years later, and they're having long-term problems. So I've actually had quite a few concussions from playing sport. The worst time I had concussion was when I was playing football and I went to head the ball and someone beat me to it, and I ended up headbutting the side of the back of their head on their really thick skull on the side of my head on my temple, which is just to the side of your eye. And I immediately lost consciousness on the floor, on the pitch, but it was only for a brief sort of moment, so no one really knew what was happening. And then when I got back to my flat, I was actually sick everywhere, which is a side effect and shows that you might have concussion if you've hit your head and you're sick. So I had to go to hospital and stay overnight. And then I actually did struggle with headaches and my vision for about 3 to 4 months whilst I was at university because of this concussion. And I actually get concussed quite easily now because my brain is, well, my head and brain is a bit weaker because of having such a severe concussion. So concussion is a brain injury when you hit your head. Fractures, these can be really dangerous, these can be really complex and serious, but some might not be as serious, so depending on how serious and complex it is, depends on the treatments you get. So as you can see, it says some fractures are so serious they result in blood loss and eventually death if not treated quick enough. So some fractures actually will protrude from the skin. So you can see in the top photo, in his sock, you can see that's actually his bone. It's a bit gross, isn't it? Sticking through his sock. There might be loads of blood loss there. That's really serious. You have to treat that as quickly as possible. Or you might get a stress fracture, like you can see it says tibial stress fracture. I've had friends who have stress fractured bones in their foot from running too much, and it's quite painful and sore, but it's not quite as serious. And they actually went a few weeks before going to the doctors and finding out they'd got a stress fracture. And they just had to get a splint, like it says there. So they put a boot on their foot, walk around with that for a while, and then the bone will naturally heal. Joint injuries, so the most common ones of these are dislocations. So lots of people dislocate their shoulder, or you might dislocate your elbow or your knee. So when a bone at a joint is forced out of its normal position. So if your shoulder, you can rotate your shoulder, but if you dislocate it, the shoulder is moved out of its normal position and you've dislocated it. And usually you have to go to hospital and you get given lots of gas and air, and the doctor has to pull and push your shoulder or your knee or your elbow until it clicks back into normal position. So that's a joint injury, a dislocation. Torn cartilage are also a type of joint injuries. We know we have cartilage at the joints. And any activity that causes you to forcefully twist or rotate your knee when you're putting your full weight on it, that can lead to a torn meniscus, a type of cartilage. As you can see, each of your knees has 2 menisci, so that's the singular for meniscus. C-shaped pieces of cartilage that act like a cushion between your shin bone and your thigh bone. And if you twist your knee and twist those pieces of cartilage, they can be torn and it can be really painful. You might struggle to put much weight on your knee. So that's an example of some torn cartilage. Sprains. So there's two things to notice here. Sprain is not the same as a strain. So SP and ST. A sprain is a damage to ligaments. So we know ligaments join bone to bone, and a very common injury is a sprained ankle. I've suffered lots of sprained ankles playing football. Sometimes when you go to put your foot down, your ankle might roll, we say, or if you're playing basketball or badminton and you're jumping, and then your ankle might swell really badly like you can see in the photo, and that's a sprain. And then there's soft tissue injuries. So tennis and golfer's elbow, where you might overuse the tendons at a joint like at the elbow and they become really sore. So tennis and golfer's elbow, they get it because they're constantly using one or both arms in the same sort of repetitive motions and putting lots of stress on those tendons, and the overuse leads to the soft tissue injury. Or an abrasion, which basically means a cut or a graze. So if we're playing football on the concrete outside and you go to shoot and you slip, you might graze your knees, you might cut your knees, and that's an abrasion, okay? So how can we treat minor injuries? The little saying to remember is RICE. So the first one for R is rest. So if you're playing and you hurt yourself, stop playing or training straight away. And then for I, you want to ice it. Ice helps provide pain relief and it also limits swelling. Compression for C, apply pressure to hold the ice on the injury. And then E for elevation, raising the injury reduces swelling further. This is because the blood drains away from the injury and there's not as much blood around the injury. So yeah, that's just a little recap of the injuries, and then a quick recap of how we might treat them using the RICE treatment. Well done.